And we go, I don't know if it's live streaming because it says it's not, but it probably already is. Gotta love it. All right, so at this point, supposedly we are live. So welcome to Wellness Wednesday. Today is World Gynecologic Oncology Day. I have to kind of try and say the whole thing there, and I have to say it slowly because it's hard to say. So today, I have a special guest with me. This is my friend, Dr. Meredith Mitstifer. I've been struggling over that. I'm just going to say it, but I think I got it. Meredith is a clinical psychologist and ovarian cancer survivor and an advocate, and she currently serves as the board chairman for NOCC, which is the National Ovarian Cancer Coalition. There we go. See, all these things I need to say slowly, which Mindy's always telling me I talk too fast on these. So those long words, are helping me slow that down a little bit. So first, Meredith, I want to give you the opportunity to kind of introduce yourself and tell us, why is Ovarian Cancer Month so important to you?
Yes, thank you. And thank you so much to Bagot for all that you do and for having me here today. Ovarian cancer is important to me because at the age of 30, while going through infertility issues and not being able to have a child for years, it was discovered that I had an unknown mass. So procedures were stopped, and I decided to wait because I had experienced gynecological issues since the age of around 19. And we waited a month, but here this unknown mass had tripled in size. They recommended surgery immediately. And upon, surgery day where you do the pre-op urine test, I was told, ironically, I was naturally pregnant. So I opted to wait until I was 4 months gestation. The surgery happened. Upon removal, the mass had ruptured and kind of leaving its contents inside me, but the fetus did survive. And a few days later, after pathology test came back, I was diagnosed with clear cell epithelial ovarian cancer, which is a rare subtype of epithelial ovarian cancers. And I was 4 months pregnant. I decided to wait for chemotherapy because that long ago, we didn't know if chemotherapy had any effects while pregnant. And today, that baby will be 21 in December. So we'll be celebrating 21 years of life. And it's important to me because over 22,000 women are diagnosed with ovarian cancer a year, and almost over 14,000 of them will die. It's the 5th deadliest gynecological cancer there is, and we have no screening tool yet. Frontline treatment is still the same as frontline treatment was for me 21 years ago. So advocacy is important, and I knew a long time ago that if I was to survive this disease, that I would do everything in my power to make sure that others could too.
And because I know you, know that you had a very special way to celebrate 20 years this year.
Yes, I don't think it had anything to do with me, but my son thought we should celebrate 20 years big. And so I thought we were going to run a 5K and I was going to have to learn how to jog. But instead, we summited Mount Kilimanjaro with NOCC's endurance platform called Team Teal. So 14 of us summited Mount Kilimanjaro in Africa to take ovarian cancer awareness to new heights, as well as hope.
That's amazing. I mean,
yeah, still recovering, Amy. Still recovering.
On your 25th anniversary, you'll probably still be recovering. That's impressive. And thanks for sharing that story with us. So, ovarian is known as kind of a silent cancer, and that's because the symptoms are rarely recognized or noticed until they're pretty far advanced. So what should we be looking for?
Yes, great question. So common signs and symptoms of ovarian cancer, while they're said to be silent, they're really not. They're just things I think as women, we tend to experience all the time and avoid doing anything about it. So bloating, pelvic or abdominal pain, trouble eating or feeling full quickly, maybe feeling the need to urinate more. And many women experience these symptoms on a monthly basis. So they don't think that there's anything that they should do about them. But if these symptoms persist, like track your symptoms, create a log, And if they're persisting for more than 3 weeks, you should go and see your doctor and ask them about it.
Okay. So that's the advice you would give if somebody was like listening to those symptoms and going, yes, yes, yes. Like the next step would be start tracking it and then go to
Yeah,
a doctor.
track it and advocate for your health.
Okay.
Ask your doctor, why isn't this possibly ovarian cancer? Because these symptoms aren't just happening a few days, perhaps before your menstrual cycle. They're happening on a consistent, persistent basis.
Okay. Okay. Definitely something to be looked for. So is there anything that we can do preventatively?
I don't know if we can prevent ovarian cancer, but there's definitely things that kind of help decrease your risk of ovarian cancer. So the use of birth control, perhaps having a baby and a history of breastfeeding, having a hysterectomy, or tubal ligation can definitely lower your risk. But things that create risk, family history of hereditary cancers, any kind of inherited or acquired genetic mutations, and then childbirth later in life, or never having a full-term pregnancy can make you at a higher risk.
Okay. Very interesting things to keep in mind as we go through. So is there anything else that you think would be important for people to know, or a way that they can help advocate, or anything you'd want to share?
I think as women, we tend to be caretakers naturally. And through that, we tend to ignore our own health. And so what I would suggest is that we advocate for our health, that we, take time to make our doctor's appointments, that we don't put our health off for anything, because we're important and you're important. And I think too often as women, we tend to just kind of dismiss symptoms or say that we'll get to it later. Ovarian cancer is complicated. There are multiple variations, stages, types, and that's why we don't have a cure yet. So it's really important to listen to our bodies, because only we as ourselves, as women, know our bodies best.
And thank you. Yes, pointing out that advocacy part. That's what Bagot is really all about, is being your own best advocate, because nobody's going to do it for you. You need to definitely do it for yourself and get out there. So thank you for joining us today. I appreciate you sharing your story and your knowledge and all the things you've learned and all the advocacy work you're doing. It's just amazing, and I appreciate it so much.
Thank you so much for having me today. And again, for everything that Bagot does to support people with cancer. No one needs to survive any type of cancer alone. And I love to be part of advocacy efforts that when this happens and it's awful and it's overwhelming, that we don't isolate and that we reach out and make sure that we have help. So thank you for all that Bagot does to help others as well.
Thank you. Well, everyone, thanks for joining us today. I hope you learned something helpful. There isn't a screening for this, but get your other screenings, because there are some out there, and those are very important. But also pay attention to your body, as Meredith was saying, and get checked if you need to get checked. And I like the idea of journaling those things and writing them down and keeping track of what you are feeling. So have a fabulous week, and we will see you all next week.
If you need more information on ovarian cancer, feel free to visit ovarian.org.
Awesome. Thank you.
Have a great day. Thanks again, Amy.
Bye.